Welcome to the Business Spotlight. My name is Jada Walker. I am your host for today's conversation, and my guest today is Maggie Ortiz. She is a registered RN, and she is the CEO and founder of Advocacy for Nurses. So today we'll be talking about her business, journey to business ownership, challenges, best practices, and share a peek of what it's really like to build and operate a business. So, Maggie, welcome to the show and thank you so much for being here today. I'd love for you to give us a little bit of your background about who you are and tell us a little bit about your business as well.
I would love to. Well, thank you for having me. I don't know if you have lots of nurses. I think that even in my own community, people are shocked that an RN owns a business outside of because I'm not a nurse practitioner. So I appreciate the spotlight. So as you stated, my name is, Maggie Ortiz. I've been a practicing registered nurse for 25 years. I started my associate's degree. I then went on to get my bachelor's and my master's. I'm not a nurse practitioner. I have my master's in leadership. I spent 23 years in a hospital setting. So what is that? I started in the ICU. I've worked in the emergency room, pre-op, PACU, endo, all these procedure areas that a lot of lay people are not going to understand. So basically everywhere but labor and delivery by choice. So I've done travel nursing, I've done local nursing, I've done flow pool. So I've done a lot of different things. After practicing for about 15 years, I did crossover to become a legal nurse. My first crossover was as an investigator for a board of nursing. So I took formal trainings called clear training. Then I came back to my respective agency, learned within that agency, and that was my aha moment and why I created Advocates for Nurses. I was seeing that nurses were not extended due process when they were put under the investigative process. What does that mean? What does due process mean? Because we hear this, right? This is a very hot thing right now. What does that mean when it's a nurse? That means if you get a letter in the mail saying that you did or did not do something by the agency that's allowing you to even use the word nurse, then if it was related to a medication that you gave, would you not like to see the medical record? Well, I think you should too as well. So that's not happening in the majority of a lot of states. And so that changed my life. I left, I developed Advocates for Nurses. I started studying up administrative law. I did go back to the bedside to where I was comfortable to the heart attack unit. So if you're having a heart attack, whether it was 2 p.m. or 2 a.m., I may have been standing over you. And then I just started studying up and seeing other things around me, around regulations, around rules, because my perspective changed. Once I
Yeah.
realized that now I practice under the three types of law, and I saw the nurses and physicians around me have no clue. Now physicians have get more education and training, and I'm speaking a little bit out of my lane here, as it pertains to litigation, as it pertains to medical malpractice, as it pertains to possibly their license. But nurses are not oftentimes extended that courtesy. And so they get a
Hmm.
letter on a Saturday morning, and it says that on or about this date, this time, you did this and tell us in 30 days. And it was 2 years ago. Yeah.
Wow. I'm like, that's like so confusing. I would definitely be at my house getting that piece of mail and being like, what is this? Like,
So
oh my
that's why
gosh.
they call Maggie, right? You ask Maggie. No one else in the
Yeah.
United States or in the world that I know of. Because if there's someone out there, please call me who does what I
You're
do.
like,
I'm
I need help.
alone. I'm alone. I'm alone. Because I just don't know anyone else who has this niche as a legal nurse. There's not a lot of
Yeah.
nurses. There's a lot of legal nurses, but people in my community reach out to me. Actually, I was on Pat Iyer's show, and if anyone knows in the legal world, then if you know, you know. She is no joke. And so I was
Yeah.
honored to be on her show, and we were talking about my niche, the administrative piece of it, and what it looks like when you hold a license. So what do I do as a business owner? It depends on what you do, right? So I
Mm.
do risk management and compliance as it pertains to someone who holds a license or employs someone who holds a professional license, because that could be very different. If you're a chief nursing officer, you hold a license, your accountability for the nurses in your business are very
Right.
different than me as a bedside nurse, and I'm clocking in just to take care of the 5 patients that I'm responsible for. So when the nurse leader reaches out to me, for example, and this is a real case, when they had staff that was TikToking out in real time stuff that was a deviation from the standard of care. We don't get on TikTok while we're at our job. And so the nurse leader needed to put a process improvement plan in place because she is held to a different standard as the nurse leader than that bedside nurse. So she had a duty to put a process improvement plan for that bedside nurse as it pertained to that conduct, to get legal and risk involved to see, was there any HIPAA violations? Can we just manage this within the organization? Or does this rise to the level where it does need to be reported to a board of nursing? And my people do not know this information from the nurse leader. So you just roll into a nurse leader role, and you've been a nurse for 5 years. You don't know this stuff, right? We're just
Yeah.
not taught this stuff. So I try to help support my people, right? I've been a nurse for 25 years. Bad things happen, unfortunately. The third leading cause of death in the United States is basically us. Is if you get called a patient, if your name changes to patient, the likelihood that you could have a poor outcome, this is research. I wrote this in my book. This is all statistically speaking. Prior to COVID, it was medical malpractice and or stuff related to healthcare is the third leading cause of death in the nation, right? Sepsis rises up there. There's other things pertaining to us. It could be, a lot of times it's related to the failure to communicate. So I teach all of these things. So I just try to provide the resources that the nurse needs and meet them where they are on their journey, or that organization, they reach out to me. So my friend says, Maggie has x-ray vision, just tell her what you do. And then she'll just snap her eyes, and then she'll tell you, so it just depends on what you need and where you're at on your journey, how I can best help support you.
It's almost like you are like the thesaurus or dictionary for nurses, like, or even like the library. You're like the library for nurses, and you hand out the information. That's like really cool. I love
Well, if
that.
I don't have it, I'll get it for you, right? Because if I don't know,
Yeah.
then I know a nurse, or I know someone who's going to help you get that answer. If I am not the nurse, but then I'm just going to help you get there. And that's what advocacy is, right? You're just
Yeah.
trying. I'm not a lawyer. I am pursuing law school, but I'm not a lawyer, right? And all I'm doing is helping you to get the information you need. No different if the doctor walks in and tells you a diagnosis. You have diabetes. The doctor walks out, spends that 5 minutes with you. I walk in because now I'm the diabetic nurse educator. So then I'm sitting down with you and I'm like, we're going to talk about things. Like for the nurse, you're under investigation. They don't even oftentimes like, what type of lawyer do I need? That's a great question. Let's talk
Mm.
about that. So then I have handouts, I have resources. Do you have professional liability insurance? You need an administrative lawyer because this is a board of nursing case. You need a civil lawyer because this is a medical malpractice case. Do you see what I mean? And a trigger
Yeah.
warning here for just a second. One of the leading causes of suicide amongst my people is a board of nursing complaint. Because as you can imagine, what we do, we almost become, and I say this lovingly, almost like a cult. We're like firefighters, police officers. You know what I
No,
mean?
really. Like you guys stand
There's a
together. There was
bond.
actually because you're here in Austin, right?
Yeah.
I think I just saw something. It was, I think, the Ascension hospital, I think over here in North Austin, they like were just on strike for something, like the nurses, and then they told them that they couldn't come back or something afterwards. I don't know. I didn't see too much of it. I just saw like a video on TikTok about it. But I was
Oh,
just
I
like,
was
that's
there.
so
Uh,
crazy. Oh, you were there? That
oh,
is
come
so
on. You know
crazy.
I
You're like, of course
was.
I was there.
Come on.
I was just like, I don't
I had to
understand why they
be, I
couldn't come
live
back.
here.
Yeah.
Because it's a contractual agreement. Some of it they knew they were not going to be able to walk into the building, but you
Mm,
procedurally have to do some things because they did go on strike. And I spoke to these
yeah.
nurses. These were the labor and delivery nurses. And let me just tell you one thing. If you see nurses standing outside the building, oftentimes women will not stand together. And we are a rough crowd to a certain degree. You
Yeah.
put just far enough and we will stand together. So if you see nurses standing outside a building, you shouldn't be going inside, I promise you, because the care you're about to receive, because the skilled nurses, the nurses who know that unit, the strike nurses who just walked in, haven't been orientated in that building, have never walked on that unit, have never
Mm.
been oriented to their surroundings. And I'm not saying that they're
Look,
not
I'm glad I
skilled
wasn't
nurses.
giving birth around this time because I definitely have been like, no,
Not a
where's the other
chance.
nurses? I need the
Not
nurses
a
outside.
chance. Yes.
That
And
is so
that's
crazy.
and I'm not for or against unions because that's like saying abortion or capital punishment or
Yeah, it
but
just
my
gets real
own
messy.
it does. But then it does bear the question, what came first? The child labor or the child labor laws?
Mm,
So why are the nurses standing outside the building? Because you have
right.
not put down the protections for us. The public doesn't know that we don't have safe staffing. Why are they standing outside the building? Because no one will come to the table for us. And what the public doesn't realize is that when we're asking for safe staffing, it's for you, because I can't be in
Right.
12 places at one time. You're in labor. Now they just gave me 3 other moms. And now your baby's decelerating. Now, do I know that? No, because now you
No.
just, and not only that, now something happens between you and your baby. You know, I'm never going to put down that moral injury. So now what did you do to me for life? You not only put me in one of the most stressful circumstances, right? Because what people don't understand is that nurses have the same, every other nurse is assaulted, that's 2 an hour, that we have the same PTSD as veterans, combat veterans.
Yeah, honestly, you guys, I feel like you guys do way more work than the doctor anyways. Like all throughout my pregnancy, all I saw was nurse, 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 nurse. Here's my doctor every now and then. And then even whenever I was in the room giving birth, it was just mostly nurses. And then they just came in whenever, it was time for delivery. So I'm like, you guys, it doesn't make any sense that you guys are like mistreated and you guys do the most, in my opinion. Like
No, we
it's
do.
just so
So think
crazy when you
about
really
this.
think about it.
They took away, because we're a female-driven profession, they took
Mhm.
away our ability to bill. And one of my mentors, she's a great storyteller, like in the 40s, and I may misquoting this, we used to be a line item on a hospital bill. Then when they figured out, but this is like 5 minutes after we were prostitutes and nuns, right? Because we couldn't be in the same room with someone else, right? So they viewed us as, that, until they moved us over to a professional. Then they needed us to come to the hospital setting. We're able to bill. Once they realized that, they mirrored the hotel industry. They rolled nursing in with the room rate. They rolled nursing in with the room rate. Because think about this. If you're in a
Oh.
hospital, now you're different, right? Because you were in labor and delivery, right? But just think
Mhm.
about this. When you're in a hospital setting, you're not there because you need a doctor. Because if you needed a doctor, you'd be at home. Why are you in a
Right.
hospital? Because you need me. You need a skilled nurse. So we allow, and we have allowed, our workflows to be created by other people. So that's the problem. Nursing doesn't own their workflows in the hospital. That's not our workflow. That's someone else's workflow that tries to meld us into it. That's why it doesn't work. But they won't give us control of our own environment. You know why? Because 80%, about 90% of us are women. Then, even to double down, there's this other, they just removed our ability for advanced practice nurses. So now in 2026, I am not eligible because I was removed from the professional list. Nursing, PT, OT, social work, teachers. So what are those all? Female-driven professions.
What in the
OT
heck?
is I'm sorry, PT is the only one. I think PT was 67%, but they're all 50% more. Ones they did not remove that from: theology, law, medicine. Huh. How about that? So what are those professions dominated by? So they removed, so if you wanted to go to be a nurse practitioner or to have an advanced degree, so that requires, if you want to be a nursing instructor, you have to have an advanced degree. Now
Right.
I cannot get a loan, right? So they've capped the loans. They can't, and I don't know all of it because this
Wow.
stuff is just evolving. But you see now they've crippled even my profession from going on
Yeah.
for loan and reimbursement.
That's kind of crappy. Like what? I'm
You
like, that
can't in
doesn't.
one hand say that there's a nursing shortage, because you can't teach nurses unless you have a master's degree or not
Right.
above. So who are you bringing into academia? So then who will teach the next generations? If in one
Oh
hand you're
my
saying there's a
goodness.
shortage of us, but then you won't give us loans. And now, I mean, most people don't realize that the Bachelor of Science is the hardest degree in the world. Guinness says this. I'm not. You can look it up in the Guinness World Book Record. The Bachelor of Science in Nursing is the hardest degree in the world. The
Oh
amount
yeah.
that
Because
we
I've had so many friends like they've gone through like the nursing program, and I'm like, I feel like they stressed more than what I did when I was in college. And I was like, I dropped out. I don't know how you haven't dropped out yet. So, and I actually, one of my best friends, she just became a nurse back in August. And I'm just like, oh girl, I love you. So I'm gonna tell her about you and be like, you need to go talk to Maggie because
yeah,
she will
just to
help you
protect
with
her
so
license.
much. Yes.
Yeah, or just follow me. I'm on every social media platform. I do stuff on all these social media platforms. My largest is TikTok, but that's the bedside nurse. LinkedIn is more so the CEO, the leaders who reach out to me for, or the lawyers who reach out to me for different things. So I just try to meet, because if you're employing nurses, then I would like to help support you through documentation. Right, I created
Mm-hmm.
2 documentation courses, because when I've seen any type of litigation, any of those 3 types of litigation, we led with, you want to see the medical record, but then you didn't document anything, or you documented so poorly, And now it's 3 years ago. Now you just drew in the organization and yourself. That could be litigation that could go. A nurse just reached out to me the other day, 7 years ago, this case. Because again, civil litigation could take a long time. Think about
Yeah.
COVID, the pushback of cases. 7 years ago, do you remember what you had for breakfast 3 days ago?
No.
I mean,
I'm like, I barely
so
remember yesterday. So it's like, no, that's so like 7 years ago. That's like whenever they ask you on applications, like, where did you live? Like your previous seven
yeah.
addresses. And I'm like, why do you need the seven? Like I only know the three, the last three. It's so crazy. Okay, so let's set the stage for the viewers a little bit. So whenever you look at your role, how many hours do you spend working in your business, like the job, and then how many do you spend on the business, like strategy and planning?
So that's a great question. So as a new entrepreneur, nursepreneur is like what we call ourselves. That is something that I'm still figuring out. And so I think we talked about this earlier, that I'm still leaning in on like the applications, people in my community. I have a coach that I'm working with because I clocked into a W-2 where my workflow was given to me. Being a
Mm,
nursepreneur, I'm still trying to figure some of that stuff out. So I set
right.
out like different days to do different things. Like I don't, on my calendar, I don't take consults on Tuesday, Wednesday, Thursday. And that was a new evolution over like the last 3 months, talking to my coach about, some of the work, the time management issues. So time management is the biggest thing. It is just me right now. I did just bring on another nurse that I'm doing like some fractional work with temporarily for 90 days. I feel like that is one of the biggest things, and I learned that from my other nursepreneur, because anyone in business knows that if you've had assistants or stuff doesn't work. And so I've had people come on and off board, just sometimes it doesn't work out, or they were just here to do a project, right? I brought them on. I used a virtual assistant. I used some of these uh TaskRabbit or Freelancer, people per hour. Some of these, I'm not trying to plug anyone's. I have no vested, to try to find some piecework to get social media posts or my website started. So being a nursepreneur, it can be, you know, can be challenging, and you really
Right.
do have to set boundaries, and time management is huge.
Yeah, no, because especially because your job is already hectic being a nurse and like helping all these other
So I
nurses
don't,
and
oh
or
yeah, so I
not.
don't work at the
Yeah,
bedside anymore. So I don't clock into the hospital anymore. I don't do
right.
that 2 years ago.
Yeah, my apologies. So you helping the other nurses who are still
Yeah.
clocking in, and that's like a lot. It's almost like you work at like a, it's almost like you're like, I don't know how to explain it. I'm thinking it in my head, but it's like the
Triage.
words,
I'm triaging
yes.
every day. Every
And
day
I'm
it's
like, my
something
words are
new.
not coming out. But you know what I'm talking about.
Yes,
Like
no,
you're
it is
literally like the
stressful.
middleman.
Yes, it can be stressful because oftentimes the nurse is crying. She's upset. It's
Yeah.
very personal to them. Even if they did something wrong, we're all human, right? That's
Hmm.
what we call just culture. Just culture is I am a human. There are human error. Now I became a nurse, I became a doctor. We look at the mitigating circumstances around the event and see, is there, a process improvement? Were 12 other people doing this? And do you see what I mean? Then you could see
Hmm.
where this button should be added. So I'm always trying to just help nurses improve their environment, the organization improve their environment, but that does come with a level of stress for myself sometimes, to your point. And
Yeah.
I clock in at 8, clock out at 4. I'm at the gym at 4:30, Monday through Friday. If you have to set boundaries in your business.
Yeah, I was just like, you sound like you're so busy. I couldn't keep I can really keep up with my 2-year-old out there. So before we get to the nitty-gritty of the business itself, let's take a look into your background a bit and what led you here. So as you look back on your journey so far, what has been the most memorable roadblock or hurdle that you were challenged with and you were forced to overcome?
Walking away from the bedside. That was probably I think I'm about to get upset here. That was hard.
Aw.
But I mean, COVID
Yeah,
really,
because I'm like
really did a
you're
number.
sometimes it's like you really do connect with those people. So
Yes,
I totally understand.
yes. So leaving the bedside, walking into spending 23 years in a hospital setting for the most part, and not
Mm-hmm.
doing that, that's been one of the biggest, because it's how I identify. I'm re-identifying myself. I'm reinventing myself. So that was hard to not be the nurse at the bedside anymore, because you're seeing differently, right? And the
Yeah.
further that I move away from that, so that was one of the biggest challenges. So I still stay connected with my people. I still get
I
invited
was
to
just
go
gonna
to
ask, are you still
places.
like
Yes,
connecting with them? I mean, obviously because they probably need your help. So they're like, yeah, girl,
yes,
I'm gonna hit you up every day. I would.
yes.
So I have yet to encounter a business owner who hasn't had peak and valleys on their journey of building a business. So how do you manage the difficult days?
Meditation, mindfulness, and these are newer practices, and these are stuff that I've learned from other entrepreneurs. Because bootstrapping is rough. It is absolutely rough, and what keeps me going is that I'm spiritual. I'm called. I do feel called. I feel very called to this space. I never felt that before. I will set my alarm to get up to the 9 to 5. I am not having to set my alarm up to because I'm called to this. This is what I'm
Yeah.
supposed to be doing. So
And there really are some people, it's like that's what they're meant to be. And then there's other nurses where I'm like, you definitely need to find something else to do
yes,
because I don't know what
yes.
you're doing.
And that's what I tell them. Even if they call me and I'm like, that you can see where are you happy? You're not. So you're a nurse. Let me say that again. You are magical, right? You have so many gifts. And it most
Right? It's
certainly
like you
doesn't
can
have to.
change someone's life even just by
Yes.
giving them a smile one day.
Yep. Or patient advocacy for a nurse. There are so many things that we can leverage our education, training, and knowledge to do. They're like, I want to be a legal nurse. I said, so why aren't you? You can do anything that you want. So I just remind nurses that sometimes we do have to step away from what we traditionally see as like value and who we are, and showing up to like clocking into a clinic or the hospital, or do you see what I mean? So that was one of the biggest
Hmm.
hurdles. Just
So being a nurse, I'm sorry, I didn't mean to interrupt you.
no, 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 just
I had this
rebranding
question.
myself. Yes, just reinventing
I just
myself.
I had a really quick question that popped in. So being a nurse, you guys are so busy. I feel like a lot of you don't take time to yourself. So have you ever like recommended to someone like, hey, just take a vacation, like, or just take some time to yourself, like take time away from work. Like, have you ever told someone that so that they can basically try to
Yesterday,
like get back on track?
yesterday, yesterday,
Really?
someone reached out to me. She was terminated from the organization she was at.
Oh,
There was a loss of a child's life. So that
oh,
not due to her, she wasn't responsible for
yeah.
this being, but she was,
It
it
still
doesn't
took like
matter
a
when you're,
toll on her.
I mean, you can't even imagine. I mean, someone who's
Yeah.
less than 3 months old, right? That's not right, right? So
Oh,
she was, so many things were happening. She was in a leadership role. This had nothing to do with her. And I said, she's like, I think I'm gonna take 3 weeks. I said, I think you should. I think you should. Yes. I said, if you can afford that, yes. Yes, yes, yes. All the gifts, all that you've done over 19 years of nursing. Yes, all day, every day. And one of my I have different themed days when I do my social media posts, and self-care
hmm.
is one of them. And chronicles, like funny chronicles, because those are two things. Because if you don't pour into you, you're not going to be able to pour into anyone else. And we pour into other
No.
people.
All the time. Yeah, that's why I'm like, you guys, you do so much, and I'm just like, you guys need to take time back for yourself, and I just feel like you guys don't, and it sucks because I just feel like, yeah, it's like it's almost like it's impossible because of the nursing shortage that we were kind of talking about earlier. So then it's like, how do you even take that time if there's no one to basically make up for your work? I guess like it's just
Those
crazy to think
top
about.
trained things. So they're like a newer thing is like where they bring like nurse coaches into hospitals or
Oh,
you know what I mean? And that's really essential. I mean, think about it. You're 21 or 20. I've worked with nurses who were giving fentanyl IV right to patients, but couldn't order a drink, couldn't go to the happy hour. Do you see
like
what I
what?
mean? And so now someone just passed, someone just had a bad outcome, and now they're 20. Right? Don't tell me that they are equipped to handle that. They're not. No one. I wasn't. Right. The first time I
Mm,
saw a 4-year-old who lost, I was 23. I was 23 years old. No one came to me. No one said, "Are you okay?" And I was a primary nurse for that room. You don't get over those things. You have to have the tools, right? And we are not taught this stuff. We're like, yeah, yeah, you should self-care. But then you walk into that. So what do you actually put in place for me to do that? It's all kind of lip service stuff, and they don't really do the things to retain us. So the turnover is high, the burnout is high. the average experience at the bedside right now is 2.8 years. 2.8 years. When you walk into a hospital setting, the experience of the nurses is 2.8 years. That should scare the nation.
Yeah,
That
like
should scare the
that's
nation. You
not
should ask everyone to ask why. Because if we don't get the public on board, we've been screaming for decades and they won't listen to us. They invite the hospital association in to stand right next to the nurses association who say that they don't want safe staffing. So what are we supposed to do about that? So
yeah,
what are
that's
the nurses supposed to do? The people who we're paying to voice our concerns, right, are not
like
speaking. We
there's like
give these
they're not even really voicing it. They just like they're like whatever,
because
who cares?
again, we're
Even though it's
revenue.
like
We're seen
that's
as that,
I'm just
but
like, do they
it's
not
not
think
even.
like what if it's me in the hospital? Like, like I'm just like, what if it's reversed? What if it's you in the hospital and you have
I
a
do
crappy
remind them of that.
nurse?
I do remind them of that. I said, when you came into this world, you were a patient. When you leave this world, you'll be a patient, right? When you came into this world, I touched you. When you leave this world, I'll be touching you, right? One of my people will, right? You don't come into this world and not have me touch you. And when you leave, because again, we are healthcare. We
Yeah,
are healthcare.
that is just so crazy. Whenever I think about everything, I'm just like, I don't see
They
how
don't
people
value
don't.
us.
No, not at all.
And it's not
But
even,
let.
think about this logically. Think about this logically. If I'm
Mm-hmm.
taking care of 5 patients and I should be taking care of 2 patients, what's the likelihood that someone's going to have a bad outcome and there's going to be litigation? Most organizations will settle under 2 million. So that's not even logical. If you had 2 more
No.
nurses, you see what I mean? Then possibly you're inviting one of these 4-letter agencies. What's a 4-letter agency? Oh, Health and Human Services, DHS, HHS. For the public, let me just tell you, no healthcare organization wants one of these 4-letter agencies in their life. This is no joke stuff. Now you're under scrutiny. Everything is looked at, and we're all fallible. We led with this. So they're going to find things that happen that were wrong because no one is perfect. Now you just open the door to so many things that you don't even know about. Now let's go back to that moral injury you just caused that nurse because she knows, or he, right? And again, I'm not being
Right.
sexist here, but the majority of us knows that I can't deliver the care that I want to deliver. I went home
Right.
and I woke up in the middle of the night because I was like, did I forget that medication? Did I not do this? Because I won't put that down. But that's the thing that people don't realize. It's not just about clocking into me. I want to deliver safe care. I want to work at the highest degree. I don't want someone to
Right.
have a bad outcome. It's
You're like, I'd
mind
actually
blowing.
want you to leave the hospital healthy and hopefully not come back?
And prevent the organization and me to be involved in any litigation. So let's just have enough nurses. Let's get
Right.
real crazy. And then if you don't, my thing as well is that they don't have enough nurses. They're still doing elective cases. They're still allowing patients to come to the emergency room. We have
Right.
things that we can do. It's called diversion. We have a thing as a community. If you can't support the community, it's required of you to go on diversion. Hospitals don't like to go on diversion because that decreases revenue. People forget when
Mm-hmm.
you walk into that building, it's a business. What's your currency?
Right.
Your insurance. And if you don't have insurance and you don't think you're going to get the same care, you are sadly mistaken. You are sad. It's a business. It's a business.
And as much as I hate to bring up like doctor shows, but like I've been watching a lot of doctor shows and I'm like, the more I watch them, the more I do realize it is just like it's just a business. And some doctors really don't care and they just want to make money and or like even the hospital, they just want to make the dollar and that's it. So I
You can
totally
be in business.
understand.
I have no problem. You and I clearly understand that, the value of being in business and that everyone has to get paid for their services. I understand that. But there's safe business practices as well. And
Right.
oftentimes they're not doing those, right? Because
Not at all.
staffing is number one, hands down. I mean, Texas just this year, they passed staffing ratios and the nurses were, I'm going to say pissed. So sorry, pissed. And so was I, because that's not what we asked for. They do these nursing committees. So what do? They send us off the unit while I'm supposed to be taking care of patients to go to the staffing committee meeting. They send us off the unit to play, and they're never going to stop. They're never going to do anything that they want. We're going to sit around and we're going to talk about, we're going to pencil out stuff that we want. That's never going to happen. I'm going to come back to my unit. Someone else had to take care of my patients. There was no one else to do, just, and none of the stuff that we talked about in that staffing committee, they just do that for lip service to send us off the unit to go and do that. You know what I mean? To say that they're meeting the
Yeah.
staffing committee requirements, but those recommendations and stuff, because there are national standards out there that could easily be pulled, right? Some states do have staffing ratios, but
Right.
why do you need to send me off the unit if we already have national standards? Well, I mean, why do we need to we could probably just use some of the stuff, but do you see what I mean? It's a game. It's a game. They're appeasing us by saying, yeah. We're going to send you off to that staffing committee. And so what? And I just told you the average experience is 2.8 years. Because you know what? I'm tired of the game. I'm not playing the game anymore because you're risking my license and the patients that are in that building. And I'm tired of the game.
Right.
You're
It's
risking
like
my license.
I hope more of the patients watch this so that they understand more
Ask
behind, like,
questions.
basically
I've
behind the
done
scenes of what
I've
you
done
guys
patient
kind of go through.
advocacy. I've done patient advocacy during COVID. Patients were reaching out to me, you know what I mean? Because you do have rights as a patient. And just like you said, you too will be a patient. But if we're
Hmm.
doing what we're supposed to do, it should not bother anyone that is a patient advocate. If you're doing
Right.
what you're supposed to be doing, then you should have no problem with people asking you questions. So I encourage everyone, it is your right as a patient, and everyone should Google patient rights and insert your state, and a page will come up of your rights as a patient.
Thank you for saying that because I'm gonna go just Google it
Do
just
it.
because later. Okay, so let's move on to what makes your business so unique. So what is one thing that you wish more people knew about your business?
That I do more than just charting courses. I do a lot more. I'm an author, I'm a speaker, I've written courses. So oftentimes I get pigeonholed because people don't really understand, like, well, like, what do you do? And I'm like, I wish I knew. You know what I mean? But it just does, it does depend on where you are at.
Yeah.
Nurses involved in a border nursing case, right? So I'm doing education around about that. It's an organization reaching out to me. I taught, I did a webinar for an hour. I am a CE provider. CE means continuing education. When people hold a professional license, my state, Texas, requires me to get 20 hours every 2 years. So
Oh
to
wow.
maintain my license when you're like, I can't remember, 2 or 3 years out of school, right? So you get your education in school, and then I think it's 2 years out of that is when your requirement starts. Does that make sense? So at
Yeah.
your first
It's like
renewal
you finish
is,
school and then like 2 years later you have to like go get it renewed or whatever.
yeah. So every 2 years you renew, but it's not till
Okay.
that first renewal that you're required to start meeting your 20 hours to maintain your license in the state.
Okay.
Does that make sense? So then
Yeah, that makes sense.
I offer CEs. So then they brought me in. I sent them to the charting course I created, and then I did an hour webinar and allowed them to ask questions. So they got two CEs, one for the course and then one for the webinar. So I help lawyers. If nurses under investigation, lawyers will oftentimes be the ones to reach out to me. I've asked to do some education for lawyers as well, because when they, whatever school you go to, I went to
Hmm.
nursing school. When I came out and I went to the ICU, I wasn't an ICU nurse yet, right? I
Right.
had to be cross-trained. So when lawyers come out, they learn law, but administrative law and representing a nurse in front of a board of nursing can be some nuances. So I help provide some training and education as it pertains to lawyers who are representing nurses that are under investigation by their across the United States. Does that make sense? Because administrative
Yeah.
law is is just administrative law. I just have to go to the rules and regulations. So I help guide them through some of those. If there needs to be an expert, if there's deviations in the standard of care, what to look for. Um, so I think that just a lot of times people just don't even know, like, what do you do? So oftentimes I normally ask them, so what do you do? Because then that will help me to better tell you what I do.
Or you're like, I do a couple different, like a lot of things, so I just need to know what you're doing so I can help you do it.
I
That's
know
so
you need
funny.
me. I know you need me. So just tell me what you do and I'll tell you what you need.
It's almost like asking Google, what does it do? Like it's a search
Ask
engine,
Maggie.
like that
And
is
that's
so
literally why I created
you
Ask
should have
Maggie.
something like that on. Oh, you actually have. I was just about to say you should have something like that on your website.
It's called Ask Maggie's. Because again, I don't, because
That is
nurses are
cool.
like, well, I just need to ask you a question. I'm like, absolutely, absolutely, love. Come on over. So I do Ask Maggie. So it's 30 minutes. So they can book time with me. It is a paid service. I would
That's
love to
so
answer all
cool.
my people's questions, but I do a lot of stuff on social media as well. If I repeatedly get the same questions or I've seen stuff, then I'll go and make a video, not
Talking
talking
about it.
about
Oh,
case, right? Because I don't want someone to feel ugly, right? But I'll even
right,
sometimes
right.
ask the nurse, like, do you care if I just make a general video just to help educate other nurses so that they don't, you know, So I try to do stuff around awareness. So if they don't want to book time with me or don't want to, pay the $50 because it's not anything really crazy, then, I tell them to go to my social media and they can check out my social media. And I have free resources on my website as well, documentation about general information about being under investigation. And then if you want to be a legal nurse. So those are just free downloads from my website. The one about under investigation links, that one's pretty detailed. And then I will even link them to the video from the National Council of State Boards of Nursing. So if I have any of my nursing people listen, you should
Nice.
absolutely get that free download and go watch that video. Because it's a little bit like Scared Straight, and I'm aging myself a little bit, but I want you to be a little scared so that when you're, walking through your nursing career, that you're pausing and thinking about things and a hospital policy and a physician order. And I'm going to quote a physician statement that was passed in 1983 in Texas. My license supersedes a hospital policy or a physician order. Let me repeat that again. As a nurse, my license and my duty to the patient supersedes a hospital policy or a physician order. So a nurse needs to be fully aware of that, because I just saw someone sent me something that said that a physician doesn't have to consent a patient, that they passed a policy. I said, that's not the law. And a surgeon doesn't have to give a patient informed consent in what universe? That's AMA 2.1. And I said,
Yeah.
nurses, your license supersedes. I would dare a physician to walk up to me and say that. I would dare. Like, are you kidding
It's
me
almost
right
like
now?
you guys should have that tatted on your arm, like, hey, read
Out.
this.
I mean, it's
Like that
just,
is,
but do you see what I mean? Do you see how these physicians as
yeah,
well try to do these things to my people? The physicians have lawyers, where most of them have. And
right.
then so if a nurse gets in trouble because they, consented a patient, and now they're standing in front of litigate, the board of nursing because the doctor said, do you see what I mean? And the organization wrote a policy, and I've seen these poor practices. But that's when I tell
Yeah,
the nurse, and always respectful. I'm never disrespectful, right, sir, ma'am, and you always do it in a professional manner. You escalate, you use your
of
chain of
course.
command, and then I will bring up, so did you want to bring up AMA 2.1, doctor? That's the American Medical Association, where it specifically talks about informed consent and how that's your duty. And I've never learned informed consent in school, and so I'm going to need you to do your job. So, but you have to be able to say that in a professional, respectful manner, because you cannot deviate from the standard of care. But nurses get bullied, harassed, other nurses will try
Yeah.
to shame them. So, I mean, I could go on and on. It's just, and your friend as well, you just have to be very knowledgeable when you're a nurse and when you're a patient. You have to be able to ask the right questions. Nursing is, it's really hard. It's really hard.
Yeah.
It's really hard.
Yeah, no, I totally understand. I've had so many friends like I said earlier, I was like they've been more stressed than me ever. Like and I'm just like, I don't see how you guys handle this stress. Like I would have quit already. Like I already know me, I would have quit just because of the stress. But yeah, I know. I totally get it. So I'm actually going to lead into marketing a little bit about your business. So it's obviously vital for every business out there, and it's something that many business owners actually forget or struggle with. So I'm always curious what successful businesses are doing. So what percentage of your monthly sales is typically invested back into your marketing budget?
Well, if I had a big marketing budget, right now it's just me. I would love to have, I had a small marketing budget before, because it is very important. It's very, very, very important to do social media and marketing. I do
Yeah,
believe,
especially in today's age. Like, yeah,
yes.
social media is like the top thing.
Well, that's where the majority of my business comes from, is honestly TikTok, right? So if I'm
Oh,
not out,
nice.
and I don't know why across the platforms, that one took off for me. But if
I
my
feel like that's where everyone
population,
is just taking off. TikTok is that thing. Like, she's that girl.
yes.
That's what
And
I
so
always say. I'm like, TikTok is that girl.
you have to stay consistent. You do have to
Hmm.
invest in social
It's definitely the
media.
consistency because I've tried. I'm not consistent. I just think of random things and I'm like, let me post this, whatever. But the people who are consistent, I'm like, yo, that is crazy how you just shot up from literally 200 followers to like 10,000 or like just even just a couple thousand. I'm like, that's just wild.
Well, and
But
then
that's cool.
repurposing your content.
Hmm.
There's like AI apps that you can use for like repurpose. So all the videos, because I've been on social media probably a little over 2 years. So I take that content and then just repurpose it. Canva has like this social media calendar now where you can schedule right out
Oh,
from
really?
there. They have a planner. I just
But
saw
I'm
this
like,
now. I don't
I
know if this
have
is the paid
Canva and I didn't
version.
realize
I
that.
don't know. So I have just the
Oh,
first tier. So there's only, and again, for your audience, don't start investing in stuff quite yet. If you feel like
right,
you're at the point where you need a website, then absolutely do that. But Linktree is far more affordable than you trying to get on a website if you're not there yet. And there's nothing wrong with that. But don't invest in something that you're not ready for. Right? I didn't make that move until like last year. I did not have a website, right? Maybe a year and a half. But that wasn't my first move. I had Linktree, I had these other things. Once my social media took off, then that's when I started, this other, the website. Also, my website has the ability to schedule out my social media. Meta has the
oh,
ability to
nice,
schedule out your social media. So there are ways that you can pick one day. So what do I do? Because it's just me and I don't have the money for a large budget yet. When I'm making
right.
$10 million a year, when I'm making $10 million a year, and I'm just going to keep putting that out there, then I will have a budget for the social media. But right now, it is just me. So on the time management, there's a day that I just work on uh doing that,
Social media,
repurposing. Yes. Yeah.
nice.
And then a blog of is or a newsletter. You could do a newsletter. You don't have to have
I always forget about those because it's like most of them get sent to like your email or whatever,
they do, but I got
and
a
no one.
large client. I got one large client from that. So it could be, as long as you're not investing a lot of time in it, because you have to think about the ROI. Is it
Yeah.
worth it? I took it down to twice a month because I was doing it 4 times a month, and you're going to have to trial some things because that is some
Mm-hmm.
free marketing that you can put right in there. And when
Right.
you cross over the entrepreneur world, this email list is the deal, right? They were what, like the first time I was like invited to a space, they're like, well, like, what's your numbers? And I was like, my numbers? Like, what do you mean? They're like, well, like your email list. I was like, I don't know. Like, where do I find this? I mean, I don't know.
Are
So
you
there's
like, I don't know.
different
I just
things.
sent it.
So currency becomes different in the entrepreneurial world. So, but
Yes.
as long as people are signing up for the email list exchange, because there's all types of laws around that. So you have to make sure that your people opt in for that if you're sharing that email list, just for anyone involved. But it's common to be invited to these summits. And then like here, you're plugging yourself, but don't pay for stuff that you don't need. And yes, social media marketing is huge. There are these other sites that you can use that I have used. I think I mentioned several, but just meet yourself where you don't have to have someone for 40 hours a week, right? Meet yourself where you are
Mm-hmm.
at, where even Handshake does interns. Handshake is some type of organizations that universities hook up with, and because the students are in graphic design, they need a project. So my
Right.
friend is doing this. She's
Oh, that's
developing
really
an
cool.
so they're looking at her course. So they signed all the NDAs. So she's got free business, free students helping her. So use resources that are available for you. So if the students are in school for social media marketing, they need something to market. So they need clients. Right now, it
No,
could be,
really.
and Handshake, it's called Handshake. Now you just
That's
have to
really
follow
cool
the
because
criteria.
yeah, I actually used to go to school for graphic design. I dropped out. My school like was terrible. But and so that's like really cool that she's doing that because I never whenever I was in school they weren't doing that. We were just doing random projects that like obviously were from years before, but like that's really nice how they work with the school and like it's almost like kind of helping them get a foot in the door before they're actually out of school. So like that's really cool. Like
Well,
man.
there's accelerators, the Small Business Association. I lean in a lot. I love the Small Business Association. For us here in
Mm-hmm.
Texas, it comes out of Texas State, right? I think it's,
I think so.
yeah. And then they have a woman's piece of it. I just signed up for like something they were offering, and I don't remember, and I don't want to misquote it, um, for some kind of like accelerator or some additional support as well. So especially when you're starting, marketing
Cool.
is oftentimes one of the most expensive things that you will spend money on,
Yes.
right? So, I mean, sometimes you'd love to have that $2,000 budget, but that's just not real, right? So you look at
No.
that and what can you do? And then you can repurpose stuff. You can ask the person that's helping you, I have content. So it decreases their hours, the amount of time that they're going to invest in your business, right? So I have the content already. I'm not asking you to create it. I just need you to repurpose it. So how much will that cost? So try to work in your budget, or say, oftentimes I don't like to tell them my budget for obvious reasons, right? Because they,
Mm-hmm.
again, they're, you know what I mean? It's a business. So what can you afford and what can they do within that budget?
I like that advice. Hopefully someone in that's listening is going to take that advice. So moving from marketing to sales, what does your sales process look like? Like if I were to refer someone over to you, like my friend, what could they expect to experience as you guide them on the choice to do business with you?
So the first thing that they should get is an automated reply. I like some automation, it was some keywords. So then, hey, love to speak with you. If you're looking to book time with me, then it is a paid service. So then they'll find a time on my calendar. It goes to my calendar. I have certain days blocked off, but they can pick the days that, and they schedule the time. It comes on my calendar. If they want to put something brief, I give them the ability to do that. And if you have a website, you can add a form to do that. That is very helpful for you when you get on. And so then I'm getting on with them, or before I look at it, we talk about some things. Your friend's a new nurse. I would be talking to her about, do you have professional liability insurance? You know, what setting are you
Mm,
looking to go into? Some of these other things. Are you looking to work days, nights? If you work nights, the experience just went down. You're a brand new nurse. Where are you at? Have you looked at that facility? Have they had litigation? Do you know what you're walking into? Do you see what I mean? Those are the conversations.
yeah.
But I would just meet her where she's at. Some of the questions she may not have, because when you don't know the question, because she's too new. So I'm going to
Mm-hmm.
put some stuff out there, and then she's going to have some questions. I would encourage her to go to
Oh,
an
definitely. My
residency
friend, she'll
program.
probably have, even though like you think she probably doesn't have any questions, she probably already has like a million questions because that's just how she is. Like she always can come up with a question. And I'm just like, how do you do that? Because even in interviews, I'll be like, no, I have no questions. And then I'll go home and have a million questions.
100%, 100%. And then they get a
So that's
follow-up email afterwards, and all that. When you're a business owner, that's not stuff you're manually doing. When you get an appointment with a dentist or your eye doctor, they're not, I'd love to tell you that they're sending that message, but they're not, right? They wrote
right.
out that message. It was loaded into automation and or to AI. And then I put them into it's a funnel. If a funnel is just a series of how you contact them, for those who don't know what a funnel
Right.
is. And mine's a 7 lead funnel. So it's spaced out. The trickle is spaced out. So it depends on what they reach out to me, the funnel that they'll be put into. And then I try to send them some resources. Then they go into my newsletter funnel as well, unless they opt out.
Okay. Nice. I like that little process. And it seems like it's like, even though there is some automation in there, it seems like you will end up getting like personal with them. So I like that.
Oh, 100%.
Okay, so let's fast forward and look at what's to come next. So where do you see your business in the next 3 to 5 years?
Well, I'm pursuing law school, so I'll have my JD.
Oh,
So
nice.
I'll be a nurse attorney. So I'm applying to schools right now.
That is so
I
cool.
looking to start in 2025. So if any law schools out there want me, you need me, I reach out to me. I'd love to go to your school. But up in the application process. So I will be advocating on a larger level, helping to get due process for nurses across the United States. There's a case that's happening in Kansas right now. The Kansas state representatives brought the Kansas Board of Nursing in front of them. I actually was
Mm.
invited to testimony the second time,
Oh,
gave some
nice.
testimony. So I want um, just national changes for nurses. Every
Yeah.
board should be set up the same. It should be no mystery that if you go to one state or another, who's overseeing your license. So those are some of my things, long-term AI education. It's bleeding obviously into our environment. And oftentimes people don't realize that, especially doctors and nurses, patients always have the ability to opt out, and you have to have opt-out options. AI is not regulated in the world, in the United States. And so therefore, we are the end user that is a tool. And so you have to give the patient informed consent, even if it's ambient listening and the documentation is happening through ambient listening. If the patient doesn't want that, and you have to have the ability to stop that AI, because it's not regulated in this country. And as a
Yeah.
license, we're license holders. So that's a big space right now. Anything around rules and regulations and prevent people from standing in front of their respective board is my future.
That's cool. I think that's gonna be like awesome for you because I just like you just seem like you're a woman who just doesn't let anyone get in their way and you're just like move like and you just have like the blinders up. So I love that for you. I'm rooting for you. So hopefully a law school reaches out or just accepts you because that's really cool.
And I would love a free ride. I mean, if that's an option,
Yeah,
I mean, I'm just going to put
right?
it out in the
Like just
universe.
give it to me.
I
It's
have
so cool.
dedicated 23 years of my life to helping other people, so I may have done a thing or two in my life. So
Right. That is so awesome. Okay. So you have had a very interesting story. So as we wrap up, I do have a few rapid fire questions. Are you ready?
yes,
Awesome. Okay. What is the key to success for you?
focus, staying focused
Okay.
and
And what is
organized.
one, oh, sorry.
Focus and organized. Got to stay
Organization.
focused. Yes.
What is one piece of advice for other business owners?
I'm going to go back to some of the stuff that don't spend money where you don't have to, because if you're financially already burdened, it's just going to burn you out even more. Just stay low, stay small. There's nothing wrong with staying small, and then utilize the free resources that are out there and get a
Yes.
mentor. You cannot do
Yes.
this alone. I promise you.
I love that one. Okay. What is a book or podcast that you are reading or listening to right now?
Brene Brown, love me some Brene Brown, love her. I actually she was on, I can't remember his show just recently. And I'm listening to her right now on a podcast. And I actually picked up two of her books this weekend at Half Price
Oh,
Books.
nice.
Got to
Nice.
get my
Okay.
mind right. Got to get your mind right.
No, really. Especially because the New Year's coming up so fast. I'm like, this whole year just flew by. It's crazy. Okay, so my last question right here is going to be it's kind of a fun question. If you had a little bit of magic dust and you could choose one spot in your business to sprinkle it, where would it be?
Organization. I want Notion. I want Notion set up, optimized, maxed out. I just want it to be my magic. If people don't know what Notion is, I don't even know all of it, but it's a project management application that does, I'm learning, seems to be everything. So that's where I would just the magic, everything would already be set up on Notion. I would just wake up on Monday morning and on my calendar and my tasks, and it would all be done.
That would be the best. I need like a little fairy. Yeah, literally a little fairy with some dust and like they can just do it all. Like get it done. Alrighty. Um, well, before we go to the final question of the day that I gave you earlier, let's share with our audience how they can follow you and learn more and contact you.
Sure. So advocates, number 4, or FOR nurses. So advocates with an S, nurses with an S, advocatesfornurses.com. My handles are all of those, advocates for nurses. You'll see the heart stethoscope with Lady Justice, and I created that logo. Lady Justice is blindfolded. The sword is in the upward position and not the downward position, and she's holding the scales of justice.
I
So
thought it looked different. I really actually loved that. Whenever I saw it on your website, I was like, that's so cool. Like,
the nurse's cap as well. I know that's very outdated, but it's an identifying thing for my people, right? I was like the first, so I graduated in 2000. I think mine was the first generation. If people don't know, nurses were wearing this white cap.
mm-hmm,
Um, it just doesn't happen anymore, but we do know that that's where that's where we came from. So
right.
I put the hat on her. She's blindfolded. So if you see my logo, it's blue, white, and red. Then you know that's me. So Maggie Ortiz, I'm on LinkedIn. Advocates for Nurses, I have a page. I'm on all the social media platforms. So if you need anything, especially if you're a nurse or you're someone in business, you have some questions or whatever, especially if you're employing nurses, but please don't hesitate to reach out.
Awesome. Well, we've come to that final question of the day, and it is, what is inspiring you today?
The nurses that I help support, that's what inspires me every single day. I really couldn't show up. I show up for the nurses to try to do everything I can so that they can show up to take care of you and your family and the people in your communities.
I love that. Okay, well, this was a great conversation. I really did enjoy hearing your story. So thank you so much for sharing. And also, I encourage all of you who are watching to save this show and come back and watch it again because Maggie really did have some great insights for business. Also, do not forget to like and subscribe to our channel so that you can get notifications every time a new conversation drops, just like this one. And thank you to everyone who joined us today. And a special thank you to you, Maggie, again for being with us today. We really appreciate it.
Thank you so much for having me on. I really appreciate it. I'm honored to be recognized as a nursepreneur.